Dr. Gibu told me, she's a fighter, I can see it. In the incubator, they're wheeling her to surgery. I'm looking in her eyes, she's a fighter. And he said, she's gonna fight you on everything. And she does.
Showing our family that no matter what, if you don't give up, you fight, you'll make it through it.
Our pregnancy and delivery were perfect, ideal. I think we were out of the hospital within 24 hours.
We brought her home to an excited big sister. She was super happy. Maybe about 2 weeks later, she was having a slight fever, and then fever kind of progressed. At that point, took Seeley to Wilcox emergency room on Kauai.
You know, because it wasn't an emergency at the time, we were very laxed and just kind of hanging out and waiting. But when the blood test came back, we could tell by the demeanor of the nurse that something wasn't right. And she had said, you know what, we're gonna run this test again. Something must have went wrong with the testing. This can't be right.
At Kauai, she had some relatively abnormal labs, which prompted their transfer to us at Kapiolani. After that first day, sending off additional labs and seeing them come back even more abnormal, I think the reality of that diagnosis became more apparent.
I remember Dr. Kiono coming in the room and he said, you know, Hailey, I'm gonna tell you that I don't know what type of cancer, but I've seen enough to know that there is some kind of cancer.
Very unusual to have an infant with leukemia. I think even nationwide, probably one of the youngest patients with this type of leukemia. We always talk about these leukemias as being curable, although for a child her age with this type of leukemia, the chances of cure are probably 50-50 or even less than that.
I had a really hard time even hearing that. And he said, you know, I'm just gonna tell you that we're gonna start treatment because if I don't start, she's gonna die by the end of the week.
You know, me and Hailey went outside to just kind of take a breath. Don't let our baby die. And I was like, okay, well, we gotta trust the team, right? And hope they can do it, you know, and save her.
It was, we're gonna do everything we can to get Seeley better. You know, it doesn't matter what the odds are, we're gonna do everything we can.
She would need chemotherapy right away. That was very scary for Sean and Hailey as well. Taking care of the parents is very important. And for us to be able to give them the reassurance or education that they really need is really helpful.
The kind of chemotherapy that you use for acute myeloid leukemia is probably the strongest chemotherapy we give to any patient.
Dr. Kiono would often tell me, you have to risk her life to save it, and you have to trust me. I know what I'm doing. And that first round of chemotherapy put her into remission, which was one of the biggest fears going into it, because Dr. Kiono had told us without achieving remission in that first round, we were in for a harder battle.
But then the problem with these types of leukemia is that they're not curable with just chemotherapy. You have to consolidate the therapy with bone marrow transplant, ideally. A bone marrow transplant in someone as young as Seeley is going to have more complications, which is why we reached out to Seattle Children's Hospital. So it was a natural connection with another Children's Miracle Network hospital to get her connected there.
So we did a few bone marrow drives. Out of that 3,000 plus people we got signed up, Seeley had 0 matches. And then it was explained to us that it is possible to do a half match, 50% match, using the parents. They tested both of us. Hailey was the better match because she's tougher.
A parent giving bone marrow to a child with the idea of saving your child's life, that's a pretty big deal. And she actually did really pretty well with her bone marrow transplant.
One of the best days besides the bone marrow transplant being successful was reuniting Ainsley and Seeley. She spent her whole life looking at pictures of her on the walls of her bed. I think that's one of my favorite memories to date.
She is now about 3.5 years after having her bone marrow transplant done. Seeley is full of fire. She's full of energy. I think the end result speaks for itself. You know, she's done so well.
She is living proof of resilience. You know, it's something they told us very, very early on, and she's proven it every step of the way.
This was truly a team effort, and this is an entire hospital coming together to take care of our most vulnerable patients.
For those who donate to Children's Miracle Network, I don't think every day you get to see the impact that you make. but we are living proof. That's the reason we have Seeley running around here today.
You know, I do this every day. It's not always an easy thing to do, but the knowledge that there are people supporting what we do is really important. You know, it's really heartwarming. So.
I feel like thank you for helping.